Welcome to Health System CIO's interview with Aaron Weismann, Chief Information Security Officer with Mainline Health. I'm Anthony Guerra, founder and editor-in-chief. Aaron, thanks for joining me.
Thank you for having me. I really appreciate it.
Oh, you got it. Looking forward to having a fun discussion. You want to start out, tell me a little bit about your organization and your role, please.
Yeah, our organization is a health system in the Philadelphia suburbs. We're about 12,000 staff, nurses, clinicians, et cetera. We have 5 hospitals, a number of different ambulatory and clinician sites, and a few corporate offices. As far as my background, I have been at Mainline Health for a couple of years. I was at Massachusetts Health and Human Services as their CISO for approximately 3.5, 4 years prior to that. And then before doing that, I was an attorney with Health and Human Services for about 5 or 6 years as an assistant general counsel there doing IT contracting, information security law, IP licensing, et cetera. I could go further back than that if you need, but I figure that's a pretty good overview.
That's a good start. Let's talk a little bit more about the attorney action. That's very interesting. So when did you decide to become an attorney? And then did you right away get into, it sounds like you were doing IT contracting as an attorney. Just tell me how the IT and the security and the healthcare evolved from wanting to be an attorney. Just take me through that a little bit.
Sure. Yeah. So I originally wanted to be an attorney, specializing in technology. My undergrad, I didn't have a technical background, but when I was in law school, I very heavily got into intellectual property law, contracting, IT licensing, et cetera. After law school, I went to Suffolk University in Boston to get an LLM, which is a master's in law in technology and intellectual property. My first job out of law school actually was at State Street Bank and Trust Company. I did finance work. I was in their investment services, office, working in their general counsel's office there. After a couple of years, the position over at Health and Human Services in Massachusetts opened up as a technology attorney. I decided I wanted to do that. And then as far as the transition into information security, I was one of 2 attorneys embedded with the IT department. So we were specifically hired to work with IT directly on their day-to-day legal needs. Obviously, Health and Human Services, very large institution in Massachusetts, about 22,000 employees, makes up more than half of state government, handles not only Mass Health, which is state Medicaid, but also handles the SNAP program, Department of Developmental Services, Department of Mental Health, Public Health, et cetera. So a number of hospitals there, a number of other public services provided. I worked hand in hand with the CIO. They have assistant CIOs handling all the different agencies. I worked hand in hand with them. And given my networking with them, when the CISO position came open, since I was counseling the CISO office and working so intently with the rest of the IT group, I put my name in the hat, and they liked me apparently, and liked me enough to keep me around for a while.
Apparently, yes, very good. So this is your first hospital job, correct? So you were with Health and Human Services, but this is your first hospital job. Tell me about that. Obviously, you bring a lot of strengths to the table. The attorney thing, I would imagine, is huge. There's tons of contracts that CISOs have to deal with. So you've obviously got a huge leg up there. I'm sure you still work with your general counsel, but maybe you're able to vet some stuff before you send it over, whereas other CISOs wouldn't. But it's also your first hospital job, probably a bit of a learning curve there, dealing with physicians and things like that. But tell me a little bit about that.
Yeah, so Massachusetts does have some hospitals in public health and mental health. This is the first job where I'm specifically focused only on that area of practice.
Right.
In Massachusetts, it wasn't the biggest area of practice by far, and certainly not the best funded compared to a private health system. So we are a non-for-profit private health system. It has a lot of the same benefits with the mission, with the passion that working for the Commonwealth of Massachusetts did. Some of the different challenges, though, are the volume of biomed devices that we have, some of the network challenges we have, et cetera. Working with clinicians specifically, all of the clinicians who worked for our hospitals in Massachusetts were there voluntarily and weren't there as their primary jobs. Mostly, there were some certainly that were. Um, at Mainline Health, everybody's here as their primary job. Everybody has to care for patients day in and day out. So things we do in security impact their lives greatly. My favorite anecdote is, our passwords, right? Having to log in and log out, having computers shut down and sign out during the middle of the day. Great security practices. If a clinician has to enter their password 60, 70, 80, 100 times, it's going to drive them insane. Right.
Mm-hmm.
And even though I might think, oh, it's 10 seconds, every time they enter a password, that adds up. That is time they're not spending with patients. That's time where, they take patient notes back to their office and they want to input those. So, burnout is a thing that we care greatly about. And, security contributes greatly to clinician burnout. So we want to make sure that what we're doing is both meaningful on the security side, but also limits the impactfulness to our clinicians.
Did you have to learn that, let's say, hypersensitivity to impeding physician workflow? Did you have to learn that? Did you have to sort of burn your hand on the stove, so to speak, or did you get it coming in? Did you understand it when you started?
Yeah, I would like to be able to say that I understood it when I started. I 100% burnt my hand on the stove probably 5 or 6 times before I learned my lesson. And,
Right.
it's a good lesson to learn, and one that I think isn't just limited to the clinician, environment. It is everywhere, right? Um, there was an article recently about someone who posted a TikTok video, I guess, about their hatred of Microsoft Teams and how terrible it was for their creative job on a day-to-day, work from home basis. It happens everywhere, right? So I think having that sensitivity towards the end user is something we forget, and I certainly forget about, in information security. Absolutely something we need to be mindful of.
Well, I love your honesty, your refreshing honesty. It's so wonderful. It's true, and thank you for being honest and real about it. That's great. One of the things, so I looked over your LinkedIn profile, and I think you touched on network. You mentioned that one of the things you did was overhaul the organization's security infrastructure. Can you tell me more about what you mean by that?
Yeah, and specifically in Mainline Health, I came on in June 2020. So 3 months into everybody being home for COVID, 3 months into the lockdown. And parenthetically, do not switch jobs if there's another lockdown ever. That was the most terrible experience in the universe. But one of the challenges for the organization is we had our hospitals open. We were running, I would say, at about 50 or 60% capacity, to be honest. Everybody else was home. We had people who did image reading at the hospital who went home and did remote reading from their home offices. We had finance people, HR, legal, IT even, that went home and worked from home and did so for about a year and a half before we started reopening in earnest. And, the big challenge there is we had made, just as I think a lot of other health systems and frankly a lot of other organizations, real investments in safeguarding our crown jewels, all of which were on-prem, right? The focus was protect what you have on-prem, protect what you have in the cloud, and you're golden. Not a lot of places supported a primarily remote work environment. When you move everybody remote, your threat landscape increases significantly. Everybody's house is now an attack vector. Every computer that's at their house is an attack vector. So how do you compensate for that? How do you handle that? Our big thing for the first 6 to 12 months was, it's not a fire we have to fight, but it's something we have to address immediately. How do we safeguard everybody in their homes? And it's interesting to see how a lot of our solution providers really adapted to that very quickly and moved to cloud-based services. Moved to services that were, more agent-based than had been previously, as opposed to like hardware EDR, for example, or hardware firewalls. And really trying to figure out how to implement that very quickly. We have great, partners. We have great support, and we have a great staff who's willing to engage in that sort of I don't want to say cutting edge technology because it's not totally cutting edge, but the way it's implemented, sort of this unprecedented implementation of it.
So that's the vendors kind of stepping up. Could you talk a little bit more about the security infrastructure? You're saying, does that involve just you doing work and upgrades on particular things, or does that involve you working with the CIO?
No, yeah, it involves me working with the CIO. It involves me working with our assistant vice president of cloud and IT operations, the folks in our strategic program office, the folks in our enterprise applications office who handle our EMR and all of the other supporting infrastructure that clinicians use on a day-to-day basis. Really, the staff at Mainline Health, the Herculean efforts to send everybody home and do so in a secure way, can't be understated. So even though we've had great vendor partnerships, we've had great internal partnerships, great uptake in secure technology, and great implementation of that secure technology.
It sounds like you mentioned all the individuals that you have to work with. Obviously, it's a huge part of being a successful CISO is building those relationships with those key people. Any advice or things that you have found work for you when trying to get a good partnership going, trying to make sure that you're going to support each other?
Yeah, take people out for coffee or drinks, right? Whichever people prefer. But and COVID really got in the way of that. So for 2 years, it was all virtual. But really try and get one-on-one time with your major stakeholders, build a rapport with them, and have them understand what you're doing and why you're doing it. However you need to do that, however you get to that point, it's absolutely critical, in my opinion.
Yeah, for sure. Um, let's talk a little bit more about third-party vendor management, which to me, I suppose it includes cloud to a certain degree because a lot of these vendors that the organization wants to bring on. So you've got a million departments, a million constituencies, a million requests for applications coming on, right? So it probably goes up through IT governance. At some point, it hits security. That's probably part of the formula now. It's got to go through security. And it may be a cloud solution. It may be they're talking about keeping it on-prem at your site. It may be on-prem at the vendor site, which I guess is also a variation of cloud. Um, or it could be in a Google Cloud. Maybe theoretically you've moved your thing to Google Cloud. It could be a million different flavors on where that application is going to live, so to speak.
Yep.
So just tell me about how that process is going now. It's a huge issue, not only vetting the new vendors that potentially are coming on, but going back and looking at the tens, hundreds, thousands, maybe not thousands, but certainly hundreds, maybe thousands of applications and vendors. Um, with COVID, a lot of things came on that didn't get the full security treatment, and now you got to go back and look at that. But just overall about third-party vendor management.
Yeah, it's one of our biggest areas of growth and one of our most aggressive areas of growth. There have been a lot of attacks really over the past year and a half only, where a lot of threat actors are now attacking common solution providers, those third-party vendors that service a lot of different clients, have a lot of very sensitive data because that's the best bang for the buck. They'll pay so that they're not embarrassed. They'll pay so that their clients aren't embarrassed. So they have that reputational thing. And in the healthcare space, they'll pay so that they aren't subject to HIPAA fines and so that their clients aren't subject to HIPAA fines. So there's a lot of incentive for threat actors to go after those kinds of individuals. A lot of incentive for us to try and safeguard that as much as possible. So IT governance actually reports up to me in our infrastructure, or our organizational structure, excuse me. And that's an area where we're primarily focused on evaluating vendor risk, and evaluating the products coming in the door. So we do architectural reviews on the products. We do security reviews of the vendors themselves. We use some common rating services that provide a highlight of what vendors are doing, where they are for their security journey, et cetera, what their public posture looks like. We found it to be pretty effective. Obviously, if a vendor has a breach, that's always going to be a surprise. But we found the notifications coming from those services to be pretty quick, sometimes even before the vendor notifies us. and we're able to address issues pretty robustly as a result of that.
Have you also looked at the implications and impact of the downtime of any particular application, maybe just the major ones, maybe more than that? Do you look at that in terms of your business continuity planning on security side and try and talk with the business and the clinical users about, hey, if this does go down, what are we going to do? Like, what are the procedures for going to paper? What are the procedures for coming back to paper? Does that all get talked through?
Yeah, and my counterpart on the IT operations side had the prescience at the beginning of COVID to bring someone on to handle that business continuity and disaster recovery function. So we have dedicated staff handling that coordinate with our office and are integrated in our incident response tabletop drills. They're integrated in our security planning, uh, disaster recovery planning generally, et cetera. So they're an invaluable resource to have. If an organization doesn't have those dedicated resources, I would highly recommend it.
Let's talk a little bit more about incident management. Is that also the individuals in charge of that? What I've thought about a lot lately are the degree to which security executives, CISOs, need to interact with, discuss, and sort of game plan more with clinical leaders, department heads, again, around the whole idea of if something happens. And then that also comes up around medical device security, where that's direct, you could have almost immediate impact on patient care. And there are people putting together sort of clinical response teams that are integrated with security and things like that. So talk to me about the degree to which uh, IT security leaders who may used to sort of live in their silo now really need to be out there understanding the workings of the business.
Yeah, and I encourage my directors to round as much as they possibly can. So get in front of those clinical leaders and really the frontline clinical workers, understand what their day to day is, and understand what they're doing to make the environment more resilient. On the non-infosec side, we have downtime drills. A lot of hospitals do. It's very easy to say, okay, information security downtime can be integrated into these downtime drills, right? We can leverage current processes that are being used in order to make our environment more resilient against security threats. It's easy for us to integrate with our disaster recovery and IT operations folks to understand what's going on there. Very beneficial to be able to do that kind of stuff. And then when we run incident tabletops, as you identified, having organizational and clinical leadership there is critical. Understanding what they're going to do, how they're going to do it, when they're going to do it, and have them understand that as well is absolutely critical. Actually, one of the things that came out of our last incident tabletop, a criticism of it, is that we didn't have enough frontline staff. So
Mm.
we included clinical leadership who is going to be organizing everything, which is great. We didn't include the people who have to implement the downtime drills, have to continue patient care. And there are real, I'm trying to think of the term, but there are champions of technology, champions of information security within our clinical staff that we can leverage for that kind of response. Those individuals are going to be included in the next round of downtime drills and incident response tabletop planning. So I think the more robust we can be, the better. And we're trying to build that robustness iteratively each time we run one of these exercises.
I mean, and that's why you run the exercises, right?
Yeah,
You run the exercises to reveal something. And then the key is not just to have it revealed, but to take concrete steps that then resolve the issue.
exactly.
Yeah, very good. You mentioned rounding, that you like to have your staff round. Uh, there's everyone's working remotely. So as you're managing a staff of people, do you have thoughts? Do you have concerns about, especially people that are hired in a remote only environment? They never worked sort of, face to face with colleagues. You've got people maybe around the country. You're hiring now people fully remote. Some people coming in. Um, I've heard different levels of comfort and discomfort with that. Some are concerned about keeping people connected to the mission if they're never around. Do you have any thoughts on leading a team and you could tell me about the degree to which they're remote, but leading a team in this new environment? It's new for everyone.
Yeah, and we are remote to a degree, but it's very important to our executive leadership, since we are a community health system in the Philadelphia suburbs, that people are integrated into the community. So the look and feel of the health system is important. Understanding the communities we serve is absolutely critical. So we prefer to hire local staff if we can, and fortunately, we haven't had issues hiring local staff.
Hmm.
We require staff to be in a certain amount of time per week, and by doing that, I think it eases the difficulty that you're highlighting, that I think a lot of businesses have, which is hiring full remote staff. The expectations to come in are different. The expectations to be on site and participate in that company culture, totally different. Where we still have that physical presence, and where that physical presence is still valued. Again, we have 5 hospitals and a ton of clinical sites. So it's those are open 24/7. That is what we are supporting. We need to figure out how to support that best. It's an easy value proposition to say, hey, your job is going to be better and easier if you go on site, if you talk to these people, and if you meet your colleagues on the business side and the operations side. So it's actually been a pretty successful model, I think. We're still working out exactly what that looks like and working out some of the kinks, but I think it's been working effectively so far.
Very good. All right. Sort of a general high level question. From a big picture point of view, what are the top, you can take this either way, either the top couple of things you're working on, or just the top trends you're seeing, maybe something you want to highlight for your colleagues that you've got your eye on, but maybe not everybody else does, something that you're looking at. So either way, either what you're working on or trends you're seeing.
Yeah, I don't know that I have any high level trends that I'm monitoring that other folks don't. Clinical burnout is a real and critical issue. Security, environmental threats, very critical issue. Ransomware threat actors, et cetera. My big initiatives are, we're looking to alleviate both of those to a degree. So one of the things we're looking at implementing is badge tap access at all of our clinical workstations. The idea being that if we can ease how clinicians interact with a PC and make that easier and more approachable, it's going to be more secure. We're going to get passwords off computers, get passwords off walls. It happens literally everywhere. And, we're really trying to figure out how best to do that in a way that is beneficial and acceptable to everybody. As far as dealing with ransomware attacks, again, it's building the infrastructure and the muscle memory that we need as an organization to be able to defend against those and have early warning and detection against those. And then, recovery from that as well. And pursuing options for how do we continue clinical operations in the event of wide scale network computing downtime, et cetera.
Yeah. So obviously, ransomware, the biggest way I guess it comes in is people clicking on the wrong thing in an email. I mean,
Yep.
there's still, business compromise emails. So, um, tell me about how you work to create an organization that's got good, I hate the term, but cyber hygiene, um, a high IQ around IT security. Who do you work with? Do you bring marketing in? Do you leverage the marketing folks, with signs and things like that around the organization, phishing, internal phishing attempts to see who you get and then try and educate them. But tell me about how you try and create that security culture.
Yeah, there are a number of different ways, and you mentioned 2 of them. So we work with our digital marketing team to figure out how we handle that through banners on the desktop, through communications, et cetera. We do the phishing exercises internally. We do phishing education on a monthly basis. We also work with HR to coordinate with managers. Okay, how are we best messaging this out to teams? How are we communicating that appropriately? And then we work with our public safety group and our patient safety group. And there are a lot of different techniques we have internally for stopping the line. We use STAR, which is and in the healthcare industry an industry standard measure for not measure but exercise for identifying and remediating risk. So we try and leverage those clinical ideas as much as possible to make it tangible to our clinical staff and make sure that our clinical staff is behaving in a safe way. So, and again, tying it to patient safety, right? There's a lawsuit going on in Alabama right now where a patient died in a hospital that was attacked by ransomware. The allegation is that the ransomware was the proximate cause of that death, we obviously don't want to have that reputational impact internally. Clinicians don't want to have that impact to patient care, the reduced patient outcomes, et cetera. So we're really looking to tie all of that together. And in addition to the communication, in addition to the training, really say, okay, this is patient safety.
Do you have discussions with HR that involve deciding what the actions are going to be taken against an individual if they click on the wrong thing, maybe repeatedly, or is that completely HR? Or is part of what you're supposed to do is communicate to HR the implications of these things so they can then decide how severe to be?
We work hand in hand with HR, but if I had to describe the process, it's the third option you mentioned, which is we communicate it with HR, we have a conversation with HR. HR ultimately includes that in its performance management. And they have a performance management schema for pretty much everything at the health system. Phishing, compromise is now one of those things that is included in that performance management.
So I've heard the CISO described as the chief risk officer, and it's your job to understand risk and communicate risk, but perhaps not to be the one deciding on how much risk the organization wants to take on or any particular part of it. Uh, so do you see that? Do you agree with that? Your job is to communicate risk to the people who will then decide, but not ultimately be the one who decides on the risk level that'll be accepted?
Yeah, and I only agree with that because I've pushed for that so hard.
Yeah.
We developed an operational risk assessment and authority to operate process internally. It mimics what NIST recommends and what the federal government has implemented, where really we document risk, we outline where we see risk, and then the business operations teams decide whether or not to accept that risk. We then report on it on a quarterly basis. And, by risk profiling the organization like that and identifying where we have hotspots of risk, I think people have become a lot more aware of risk and a lot more receptive to conversations around risk.
Yeah, I wonder if CISOs, and I'm sure it happens, get in a situation sometimes where uh, more risk is accepted than they're comfortable with. And I guess if that happens, you just have to decide if that's a place you want to work,
Exactly.
right? Because the breach is still going to be on your resume as
Right.
having been working, having worked there when it happens. So it's a very interesting balance. Okay, we're just almost out of time. I wonder if you had any final piece of advice for your CISO colleagues, something that you found has really worked for you in your experience. Just anything you want to offer them at this point.
I would say persevere. A lot of the fellow CISOs I've talked to, a lot of the CISOs I worked with on the legal side, it is a drag sometimes, right? You're pushing an agenda, you want to push security. To your point, some organizations are just more risk accepting than others. It is difficult on a day-to-day basis to deal with an organization, I think, where you don't align on a risk posture with them. One option is certainly finding a place that does, and I've been very fortunate in my career to find a couple of places that align with my personal risk tolerance as well. What my professional opinion would be. But if you're unwilling to leave your organization or you want to challenge, persevere and keep pushing for the risk acceptance that you want to see. And I think eventually it's difficult not to be able to make that case effectively over time. It just takes time, it takes effort, and really being able to communicate that tangibly to the business in a non-technical way is absolutely critical.
I love the phrase you just used, align on a risk posture, because it really explains where you want to be. Um, and I guess that's something you're going to try and figure out during the interview process. As a security professional, if you're interviewing for a CISO role, that would be one of the things I would think would be one of your objectives during an interview is to see, are we aligning on a risk posture? Because it could go either way. The
Right.
organization could be too risk averse, or the organization could want to take on too much risk. So too much risk, you're risking a breach, not good. Um, but the other way, too aggressive, and you're inhibiting user experience, and then you're going to have people screaming at you all day. I can't work like this. So you want to align, right?
Absolutely. And either you find it out during the interview process or you find it out in the first month you work there, but you will find it out very, very quick.
And that's not a situation we want to be in. I'm
No.
sure that's not fun. Right, right. Well, excellent, excellent talk today, Aaron. I want to thank you so much for your time.
Thank you. I really appreciate your time as well.